Most people think that once your arteries start to clog, the only way out is through a pharmacy or a surgical suite. But what if I told you that the most powerful tool for unclogging your blood vessels, and I use that term scientifically to mean reducing plaque instability and inflammation, isn't found in a pill bottle? It's found on the end of your fork. I'm Lina, and today we are breaking down the absolute best meal for heart health. This isn't just healthy eating in a vague sense. We are talking about a targeted, 3-course biological intervention. Every single ingredient we're about to discuss targets the 4 major drivers of heart disease: oxidation, inflammation, high blood pressure, and insulin resistance. Excited? By the end of this video, you won't just have a recipe, you'll have a blueprint for how to turn your dinner into a literal defense system for your cardiovascular health. Stick around because the dessert, yes, I said dessert, actually contains a compound that competes with cholesterol for space in your body. Before we get into the kitchen, let's get real. I speak to people every day who are terrified of their family history or a recent high cholesterol lab result. The standard advice is usually, eat less salt and take this medication. Now, medical intervention has its place. If you have active chest pain, go to a doctor immediately. But for the millions of us looking to prevent a crisis or manage early-stage issues, food is the primary treatment, not just a complementary one. The goal today is to lower your ApoB carrying particles. You've probably heard of LDL, the bad cholesterol. But the real danger isn't just the number. It's when those particles get rusty or oxidized and get stuck in your artery walls. This meal is designed to sweep those particles away, stabilize any existing plaque so it doesn't rupture, and keep your blood vessels as flexible as a rubber band. We start with a lentil, rocket, and walnut salad with an extra virgin olive oil and tahini dressing. Why lentils? Because of soluble fiber. Think of soluble fiber as a physical sponge. Your liver uses cholesterol to make bile. Usually, your body recycles that bile, but soluble fiber binds to it and drags it out of your body as waste. To make more bile, your liver is forced to pull LDL cholesterol out of your blood. You're literally using up your cholesterol. To make this, you'll need 200 grams of green lentils. Simmer them until tender but firm. These are your fiber powerhouses. Add a handful of walnuts, which provide alpha-linolenic acid, a plant-based omega-3 that helps stabilize the cap on any existing arterial plaque, making it less likely to rupture and cause a heart attack. Pile this on a bed of rocket or arugula. This peppery green is loaded with dietary nitrates. For the dressing, whisk 3 tablespoons of extra virgin olive oil, a tablespoon of tahini, the juice of 1 lemon, and a crushed garlic clove. A quick tip on the oil: it must be extra virgin. Regular olive oil is often refined, which strips away polyphenols. Polyphenols are the antioxidants that prevent your LDL from oxidizing. If cholesterol doesn't oxidize, it's much less likely to cause the inflammation that leads to blockages. Now for the heavy hitter, the main course. We are making baked salmon with steamed broccoli and quinoa. If the starter was about cleaning the blood, the main is about healing the vessel walls. We are targeting the endothelium. That's the thin lining of your blood vessels. When it's healthy, your vessels dilate easily. When it's damaged, they become stiff, leading to high blood pressure. Preheat your oven to 180 degrees Celsius. Take a salmon fillet, drizzle it with olive oil and lemon, and bake for about 15 to 20 minutes. Salmon is one of the richest sources of EPA and DHA, the long-chain omega-3 fatty acids that lower triglycerides and dampen systemic inflammation. While that's cooking, prepare 80 grams of quinoa. This is our low-glycemic carbohydrate. Unlike white pasta or rice, quinoa doesn't cause a massive insulin spike. High insulin levels are like liquid sandpaper for your arteries. They cause microscopic damage that plaque loves to cling to. Alongside this, steam some broccoli and spinach. These greens are high in nitrates, which your body converts into nitric oxide. Nitric oxide is a gas that tells your arteries to relax and open up. It is the most potent natural blood pressure regulator we have. You didn't think we'd skip dessert, did you? We're having full-fat Greek yogurt with berries and pistachios. I know, I said full fat. For years, we were told all saturated fat is the devil, but fermented dairy like Greek yogurt has a different effect on the gut microbiome. This dessert is a masterclass in heart protection. First, you have the pistachios. These are rich in phytosterols. Chemically, these look almost identical to cholesterol. When you eat them, they compete for the same receptors in your gut. The pistachios win, and the cholesterol gets sent to the exit, never entering your bloodstream. Then you add a large handful of berries, like blueberries or blackberries. These are packed with anthocyanins. Research shows these pigments directly improve endothelial function within hours of consumption. Finally, the yogurt itself supports the gut-heart axis. The probiotics in fermented yogurt help create a microbiome that lowers overall body inflammation. A quiet immune system means less inflammation in your coronary arteries. To wash it all down, we aren't reaching for soda or even juice. We're drinking plain kefir. Kefir is a fermented milk drink that contains a much wider variety of bacterial strains than standard yogurt. The bacteria in kefir survive the journey through your gut better than most supplements. They colonize more effectively and have a measurable effect on your microbiome health. A healthier gut microbiome means better regulation of your inflammation levels and lower heart attack risk. If you don't like kefir, kombucha is a reasonable fermented alternative, but kefir is the powerhouse here. Let's be clear, you don't reverse heart disease with one single meal, but what you do with every meal is send a biological signal to your arteries, your immune system, and your endothelium. The signal from these 3 plates is one of repair rather than damage. Think about what we've achieved in just one sitting. We've lowered the LDL burden through fiber. We've reduced LDL oxidation through polyphenols. We've stabilized existing plaque with omega-3s. We've improved blood vessel flexibility with nitrates. We've controlled blood sugar to prevent arterial scarring. And we've supported the gut microbiome to keep inflammation at bay. Most medications target one pathway. This meal targets 6 simultaneously. The research on this is absolutely real. Lifestyle interventions have shown actual regression of coronary plaque in clinical trials. If I were concerned about my heart health, I wouldn't start with a detox or an expensive supplement. I would start here with a plate that understands the disease process. I want you to focus on the quality of the food on the plate, not the calories. Move away from the mindset that less is better. With food like this, you are taking medicine. Eat until you are full, get the full dose of these nutrients, and let the food do what the evidence shows it can do. You'll probably find that your cravings for processed sugar go down as a result because your body is finally getting the high-quality fuel it has been asking for. Heart disease remains the world's leading killer, but it doesn't have to be your story. It starts with the very next meal you choose to prepare. If you found this breakdown helpful, please hit that like button. It helps this life-saving information reach more people who need it. Subscribe to join our community focused on longevity and science-based wellness. I want to hear from you. Which of these 3 courses are you most excited to try? Or do you have a heart-healthy superfood you swear by? Let's get a conversation going in the comments. I'm Lina. Stay healthy, stay informed, and I'll see you in the next video.